Welcome to the Deep Dive, everyone. In this deep dive, we're tackling a topic that's super important for nursing students: values and ethics.
Yes.
We're going to use examples that you'll actually relate to, stuff from your textbooks and real-world stuff. And to help us out with all this, we've got an expert with us today.
I'm glad to be here, helping new nurses, like you guys, figure out this whole ethics thing. It's something I'm really passionate about.
Totally. I think every nurse at some point, right, faces that question. Not just how to do something, but should it even be done? Like, it's not always so clear-cut.
Yeah.
So let's start with the basics. Values. What are they, and why should nursing students, like yourselves, even care?
Values. They're those those beliefs we hold deep down, the ones that really drive what we do. Think of them like your inner compass, guiding our decisions. Think back to the start of COVID, remember, how people reacted to masks and lockdowns, all that. It was often shaped by their values, right? Some folks, they were all about individual freedom, while others, they valued safety more, the safety of everyone.
Yeah, okay, that makes sense. So how do these values, these personal values, play out when you're a nurse taking care of patients?
Well, everybody's got their own, value system, right? What's most important to them ranked. And this shapes how they see the world, including their beliefs about health and illness.
Yeah.
So we as nurses got to be aware of our own values and how they might, affect how we interact with patients. But just as important, we have to try to understand our patients' values too. If someone really values independence, for example, they might resist medical advice, especially if they think it limits their freedom.
So it's before we even get to treatments and all that, we need to understand what makes our patients tick, what matters to them.
Exactly.
Yeah.
And to do that well, we need to think about how we got our OWN values. Go back to your childhood. Did your family, demonstrate certain values like honesty, compassion, that kind of thing? Were there rewards for being good, punishments for being bad? All those experiences, they add up, right? They make up our value system.
Okay, so I'm guessing there are certain values that are super important for professional nurses.
Oh, absolutely. The American Association of Colleges of Nursing, they've got 5 core values for nurses: altruism, autonomy, human dignity, integrity, and social justice. And these are the foundation of ethical nursing practice.
So can you give us some examples? What do these values look like in action?
Sure. Altruism, that's all about putting the patient's needs before your own. Speaking up for vulnerable patients, someone who can't speak for themselves. That's a great example of altruism in action. Autonomy, that's respecting the patient's right to make their own decisions about their care, even if we don't, agree with those decisions. And human dignity, that's treating every patient with respect, recognizing they have worth, no matter their background, no matter their situation.
So it's more than just doing the right medical stuff. It's about seeing our patients as whole people with their own values, their own life experiences.
Yeah, that's a great way to put it. And that's where this idea of values clarification comes in. We don't want to force our values on anyone, right? It's about figuring out their values so we can provide, truly patient-centered care. Let's say you have a patient who really prioritizes their job, even over their health. Instead of judging, maybe we could try to engage them, frame things in a way that fits with their values, staying healthy so they can keep working, keep supporting their family.
That's a good point. It's meeting our patients where they are, both physically and emotionally, right? But what happens when values clash between the nurse and the patient, or even within the healthcare team? That's where ethics comes in, right?
Absolutely, yeah. Ethics, it gives us a framework for those situations where there isn't a clear, easy answer. It helps us make decisions that are morally right, even when the right path isn't totally obvious.
Right. Right. So values, those are our beliefs, what WE think is important. But ethics, that's different. It's the study of, right and wrong. It's about using moral principles when things get complicated. And in healthcare, it's huge E.
So if values are our compass, then ethics is the map we use when we hit those tricky ethical intersections.
That's a really good way to put it, yeah. And just like a map, ethics helps us see the whole picture, see the different paths we could take and choose the route that's, the most ethically sound.
Okay, so how does this map reading actually work in nursing, I mean? Okay, so first, important thing to remember, something can be legal, totally by the book, but not ethical, and vice versa. Take the case of Mr. Rains. He's homeless and he was getting his meds, free samples from a clinic. Then policies changed. Clinic couldn't give out samples anymore, so he's stuck with prescriptions he can't afford. Legally, the clinic did nothing wrong. But ethically, it raises some questions, right, about access to healthcare, whether it's fair. And that's a huge concern in nursing ethics.
Yeah, that's a perfect example. Ethics pushes us beyond just the rules. It makes us think bigger about the impact our actions have on patients, on communities, the whole picture.
Exactly. And nurses, they're managing more and more care these days, so these ethical things, they become even more important. The ANA, the American Nurses Association, they have this scope and standards of practice. It stresses how important it is for nurses to be ready to handle ethical stuff. They even give, like, specific recommendations to help us.
So it's not enough to, like, just be good at the skills, the technical part. We need those ethical muscles too, right?
Yeah.
But where do we even start? Are there, like, different ethical theories, frameworks, something to guide us?
There are. Two big ones, they lay the groundwork. Utilitarianism and deontology. Utilitarianism, it focuses on the outcomes. So if something you do leads to the most good for the most people, that's considered ethical.
Kind of like weighing the good and the bad. For the majority, I mean. Like a cost-benefit thing.
Exactly. But deontology, that's different. It's about rules, duties. Something is right or wrong based on principles. Doesn't matter what the outcome is.
So sticking to your principles, even if the results aren't, ideal.
Yep. And these two, they clash a lot in the real world. Think about abortion, for example. Super complex, right? Depending on which ethical theory you're leaning on, you might end up with completely different views. Understanding these theories, though, it's crucial. There are tools. The tools we use to analyze those tough dilemmas.
It's like having different lenses, one for the outcomes, one for the principles. But how do we actually see these theories? Like day to day as nurses?
That's where this thing called the principle-based approach comes in. It kind of mixes utilitarianism and deontology. It focuses on four main things: autonomy, nonmaleficence, beneficence, and justice. Autonomy, we've talked about, respecting the patient's right to make their own choices. Nonmaleficence, that's our duty to, not cause harm.
Yeah.
Beneficence, that's actively trying to help our patients. And justice, it's fairness, making sure everyone gets equitable care.
Okay, on paper, those seem pretty clear. But I bet when you're actually in a nursing situation, it gets a lot messier.
Oh, it can. Take Marissa Sandoval, for example. She had these serious complications after surgery. She wants answers. But the healthcare team, they're not giving her any. That brings up fidelity. That's our duty, to be honest, keep promises to our patients. And it also challenges the nurse's integrity, right? When a patient's needs aren't met.
So the nurse is stuck between what they owe the patient and their loyalty to the healthcare team.
Yeah, exactly. And that's why ethical decision-making, it's so important, helps us when things get conflicted. But the principle-based approach is not the only ethical framework. There's also the care-based approach. It focuses on the relationship, the nurse and patient, and emphasizes empathy, compassion, really being responsive to what the patient's going through.
It sounds like that fits in perfectly with, person-centered care. Seeing the whole person, not just their symptoms.
It totally does. And it shows us how important it is to cultivate things like kindness, being attentive, empathy, qualities you can't learn just from a book, right?
You're so right. Those are the things that make a truly great nurse. But what about when we know the right thing to do, but something's stopping us?
Yeah.
Like something outside of our control. Isn't that what moral distress is?
Exactly. It's that awful feeling you get when you know what's ethically right, but you can't do it. Because of policies maybe, or lack of resources, something like that. Imagine a nurse who knows a patient needs a specific treatment, but insurance won't cover it. Talk about moral distress.
Ugh, sounds so frustrating. What are some signs of moral distress that, nursing students should be aware of?
It shows up in different ways, Maybe changes in your sleep, you get more cynical, detached from your colleagues, feel hopeless. Paying attention to those signs, it's important. And remember, you don't have to go through this alone.
So what can nurses do if they're feeling this way? Who can they talk to?
Talk to someone you trust, a colleague, a mentor. Sometimes just saying it out loud helps, getting a different perspective. Self-care is huge too. Sleep, food, exercise, doing things you enjoy.
Sounds like taking care of yourself, overall, is key for handling these ethical challenges.
It really is. And there are some great resources out there. The AACN, they have a model for dealing with moral distress. And there's a Moral Distress Education Project. They offer guidance, support, a sense of community for nurses struggling with this stuff.
So a whole support network out there. But what if a nurse feels like they absolutely can't do something because of their beliefs? Is there a formal process for that?
Yeah, there's conscientious objection. It's a formal way for nurses to say, hey, I can't participate in this. If it goes against their deep beliefs ethically, it's not about avoiding work. It's about upholding your ethics, advocating for what you think is right for the patient.
So say a nurse has a moral issue with a certain procedure, they can, like, formally ask to be excused.
Exactly. It takes open communication, respect, and a willingness to find a solution,
Yeah.
Something that works for everyone. In the end, it's about making sure nurses can practice in a way that matches their ethics and those professional standards. But conscientious objection, it's not something to be taken lightly. You got to weigh everything, and understand what might happen.
You're right. Serious stuff. Shows how important it is to talk openly and to have a work environment where nurses feel comfortable speaking up.
Yeah.
But even with support, these ethical dilemmas, they can really take a toll. That's where moral resilience comes in, right?
Yes, moral resilience. Bouncing back from those tough ethical experiences, it's about learning to cope, to deal with moral distress, keep your integrity, and come out stronger on the other side.
So like building up our defenses so we can handle the ethical fights that, let's face it, we're going to face as nurses.
Exactly, like building your ethical core strength. And the American Psychological Association, they have some great tips. Build positive relationships. Accept that things change. Focus on what you can control. It's about having a support system, being flexible, and feeling like you have some control, some agency.
Makes sense. Being proactive, getting ready to handle whatever ethical curveballs get thrown at us. But what happens when those curveballs are so intense they leave a real mark? I think I remember the textbook mentioning moral injury.
You got it. Moral injury, it's a step beyond moral distress. It's a deep wound. It happens when someone's morals, like their core beliefs, get betrayed, often by someone in authority or in a really high-stakes situation. Imagine a nurse seeing a patient mistreated or being pressured to give care they think is harmful. That could lead to moral injury.
Sounds like a betrayal, something that shakes your whole belief in right and wrong.
It is, and the effects can be really bad. Guilt, shame, anger, you lose trust. It's hard to connect with people, even suicidal thoughts. And sadly, a lot of times, moral injury, it goes unnoticed in healthcare.
So how can we support nurses who are dealing with this? What can we do?
First, we got to make people aware of it, that moral injury is real and serious. We need a culture where nurses feel safe to talk about it without judgment. Resources are key, too. Counseling, peer support, education, that kind of thing. But it's not just about treating it after it happens. We need to prevent it.
How? Where do we even start?
We need workplaces that are ethical, where being open and accountable is valued. Nurses need a voice in making decisions. They need to feel empowered to advocate for their patients and themselves. Moral injury, it's a wake-up call. We all need to build a healthcare system that's more ethical, more compassionate.
So we're talking system-wide change. But is there anything nurses can do day to day to protect themselves and their colleagues from this moral injury?
Of course. Start with communication. Be clear. Be open. Advocate for your patients. Speak up if something's wrong. Make sure there's respectful dialogue in the team. And practice self-care. By yourself, A&D together. Take care of your needs physically, emotionally, spiritually, and get support from your coworkers, mentors, professional organizations. When you're in those ethically tough spots.
It's all about support, being open, and taking care of yourselves. Actively, I mean.
Right. And remember, moral injury, it's not a weakness. It happens because you experience something ethically wrong. It's a call to build a healthcare environment where that kind of thing is less likely to happen.
That's a good point. It shows that, as nurses, we have a duty to uphold those ethical standards and build a system where moral distress and moral injury, they happen less. But practically speaking, how do we handle those tough decisions?
That's where that 5-step process comes in. For making ethical decisions, remember, assess the situation, get all the info, diagnose what the ethical problem is, plan, think about what might happen with each option, put your decision into action, and finally, evaluate. Think about what happened, learn from it.
So it's like a roadmap for ethical decisions. Figure out where you are, where you're going, map the route, then reflect on the trip. But what about those 8 ethically relevant things, the considerations the textbook talked about? Where do they fit in?
Those are like checkpoints. Along the way, they make sure we stay on track, make sure we're thinking about every angle.
Okay, so they keep us ethically grounded while we're figuring all this out.
Exactly. They remind us how complicated things can be, at the bedside. And they help us take those big ethical principles and use them in real-life nursing.
Okay, let's look closer at them. The first one, balancing the benefits and harms in patient care. That seems pretty straightforward, right? Do what's best for the patient.
Of course. But it's not always black and white. Treatments have side effects. And what helps one patient might hurt another. We have to weigh things carefully. the potential good and the potential bad. And think about each patient's needs, their situation.
So it's personalized care. What's best is different for everyone. But how do nurses actually figure this out, it seems like? A lot of responsibility.
It is. But that's where our relationship with the patient comes in. We spend so much time with them, we see how they respond, we listen to their worries, we advocate for them. We're in a perfect spot to see those little things, to understand how a treatment might affect their whole life, their quality of life.
It's like we have this insider knowledge,
Yeah.
something that goes beyond the charts and the test results.
We do. And that brings us to the second consideration. Disclosure, informed consent, shared decision-making. Making sure patients have all the info they need to make real choices about their care.
So it's not just giving them a list of options. It's about giving them the power to be part of the decision-making.
Exactly. We're moving away from that old way where the doctor decides everything. Now it's more collaborative. The patient's values, what they want, that's at the center.
It's recognizing that the patients, they're the experts on their own lives.
Absolutely. And nurses, we're a big part of this. We're good communicators, good educators. We can help with those conversations between patients and doctors, making sure decisions are made together respectfully. We can explain complicated medical stuff so patients understand, help them think about the risks and benefits, make sure their voice is heard.
Okay, what's the third one? What else do we need to think about?
The third one is family life, how things work in the family. We have to remember, patients aren't alone. Their illness, their healthcare choices, they affect everyone around them. Family, loved ones.
So think about the whole support system, the web of relationships around the patient.
Exactly. We got to be sensitive to how families work, the roles that everyone plays, and how an illness can mess things up.
Seeing the patient as part of a bigger picture, not just a person getting care.
Right. And respect those family dynamics, even when they're complicated. We might need to help them have tough conversations, mediate disagreements, or just listen.
Sounds like this one takes a lot of empathy and being sensitive.
It does, and it shows how important communication is. Working with families, making sure they feel supported, included. They're often the ones giving care at home, making decisions, riding the emotional roller coaster of illness.
That makes total sense.
Yeah.
What's number 4? What's the next ethical thing we need to think about?
The fourth one is a relationship between clinicians and patients. This is big for nurses because we're all about building those strong relationships, those therapeutic relationships.
For sure. I can see how that relationship, the quality of it, could really affect the ethical side of care.
It really does. Trust, respect, empathy, compassion. Those are the foundations of a good, ethical clinician-patient relationship. When those are there, you can talk openly, you can address concerns, you can talk about those ethical dilemmas and solve them together.
It sounds like that trust, that mutual respect, it's like essential for navigating the ethical gray areas that pop up all the time in healthcare.
You got it. When that foundation is solid, it's so much easier to have those tough conversations, see different sides, and make decisions that respect everyone's values. Okay, ready for number 5?
Hit me with it.
All right, number 5. It's about the professional integrity of clinicians. It's about making sure healthcare providers, they don't have to go against their own ethics, their own standards.
So protecting them, ethically, making sure they can practice in a way that they feel good about morally.
Exactly. Clinicians, they have a duty to provide good ethical care, but they also have the right to protect their morals. If a nurse is asked to do something they think is wrong, harmful, unethical, they have a right to say no.
Makes sense. Healthcare providers, they're moral agents too, right? They have their own beliefs about right and wrong.
Exactly. This shows how important it is to have workplaces where people feel safe speaking up, advocating for what's right, and getting support when things are ethically tough.
That's a powerful message, especially for, nursing students. Just starting out, we need to remember we have a voice, and what we think ethically matters.
Totally. Speaking up for what's right, that's a core part of being a nurse, a professional. Now, ready for number 6? This one's a biggie. Cost effectiveness and allocation.
Oh yeah, the money part of healthcare. Can't ignore it, even when we're talking about ethical care.
Nope. It's a reality. Resources are limited. We have to make tough choices about how to use them. Nurses need to be aware of how money's being spent and advocate for fairness, making sure resources are spread out fairly.
So it makes us think bigger about the whole system, how we spend healthcare dollars.
It does. It's about making smart choices, choosing treatments that work, using resources wisely. And it's about recognizing that healthcare, it's not equal for everyone. Some people have way less access to good care.
So it's not just about saving money with each patient. It's about advocating for a system where everyone gets good care fairly.
Exactly. It's complicated, no easy answers. But it's a conversation we gotta have. Nurses are on the front lines. We see the impact of these decisions every day. What we think, our perspectives, they matter. We need to speak up for a system that's fair.
I'm with you there. It's a big responsibility, but also a huge chance to make a real difference. Okay, we've done 6. 2 left. What are they?
Number 7 is about cultural and religious differences. Basically, recognizing that different cultures, different religions, they have different ideas about health, illness, treatment. We have to respect those differences and not push our own beliefs on our patients.
So like being humble, knowing our way isn't the only way, and respecting what each patient believes, what's important to them.
Exactly. It's about culturally sensitive care, honoring that people are different. It also means looking at our own biases, our assumptions, making sure we're giving care that's fair and unbiased to everyone.
Good reminder, especially in a place as diverse as this. Okay, last one. Number 8. What is it?
Last one is power dynamics. Recognizing that in healthcare, there's always a power difference. Patients are vulnerable, and clinicians, we have authority.
So being careful with that power, using it responsibly, ethically.
Exactly. We can't abuse our power or take advantage of patients being vulnerable. We also need to stand up for patients who can't speak for themselves. Make sure their voice is heard, their needs are met.
This whole list is amazing. It's like a checklist for ethical practice. Makes you pause, think things through. It's not just rules. It's about understanding people with compassion and integrity.
Couldn't have said it better myself. And it's a good message for all those future nurses out there. Ethical decision-making, it's part of everything we do. It's about being there with our patients, hearing their stories, understanding them, and fighting for them.
It's bringing everything we have to the bedside. Our knowledge, our skills, but also our compassion, our commitment to doing the right thing.
Exactly. And it's about always learning, looking at our values, our biases, and trying our best to give the most ethical, compassionate care we can.
Wow. This deep dive has been so eye-opening. We talked about values and ethics, different theories, different ways to approach things, and those practical considerations that help us decide what to do.
And we talked about moral agency, moral resilience, and those tough challenges of moral distress and moral injury.
One thing that really stuck with me is that, making ethical decisions, it's not a solo mission. We need each other.
Yeah.
Colleagues, mentors, resources, even our patients. We need them to help us through these tricky situations.
Absolutely. We're all in this together. And that brings us to one last example. It shows all these ideas in action. The story of Jean Watts. She's a labor and delivery nurse, and she comes face to face with a really tough ethical dilemma.
So tell me about Jean Watts. How'd she handle this ethical thing?
Okay, so Jean, she's taking care of this patient, right? And the patient's scheduled for a C-section, and she's been super clear she wants to be awake for it. She even requested a specific type of anesthesia.
Sounds pretty normal so far.
It is, yeah. But then things get, complicated. The anesthesiologist tries to give her the anesthesia she asked for, but it doesn't work. And the OB, the doctor, they're getting impatient, so they tell the anesthesiologist to just put the patient under.
Well, hold on. That's like totally ignoring what the patient wants. Her right to choose what happens to her own body.
Exactly. And Jean, she sees this right away. It's a violation of the patient's autonomy. But she's in a tough spot, She wants to stick up for her patient, but she's also got to follow the doctor's orders.
I bet. What a dilemma.
It is. So what does Jean do? She uses that 5-step process, remember, the one we talked about, to guide her actions.
Okay, yeah, walk me through it.
First, she assesses, gets all the info, the patient's medical stuff, what the doctor's thinking, any hospital policies, all that. She's getting ready to make an informed decision.
She's not, jumping the gun or letting her emotions take over.
Exactly. Then she figures out the ethical problem, which is, the patient wants one thing, the doctor wants another. It's a clash. She clearly defines what the dilemma is.
Okay, so problem identified. What next?
Now it's planning time. What are her options, and what might happen with each one? She could just stay quiet, do what the doctor says, but that goes against her ethics, and it risks losing the patient's trust. But if she speaks up, there might be conflict, maybe even problems with her job.
Talk about being between a rock and a hard place.
Totally. No easy answers. So Jean, she decides to talk to the OB. But after the delivery, when things are calmer, she explains what she's worried about and advocates for the patient's right to make her own choices. She realizes that, confronting the doctor right then, in the middle of everything, it might just make things worse.
Smart move. Go for the conversation, not the fight.
Right. And she's also thinking about the future. how to prevent this from happening again. She sees it as a bigger problem, not just a one-time thing.
So she's not just trying to fix it for this patient. She wants to make real change.
Yep. She might have to challenge how things are done, push for policies that protect patients better, maybe even teach her colleagues about informed consent, how important it is. Jean's story, it really shows how nurses can use their voice for ethical practice.
Love it. Even when it was hard, she stayed true to what she believed and fought for her patient.
It reminds us that making ethical decisions, it's a journey, not a one-time thing, and it takes guts and compassion. But Jean, she also shows us something else, how important it is to reflect. She didn't just forget about it after it was over. She thought about it, what she learned, how she could grow from it.
Yeah, that's huge EE. Turning those tough times into, learning experiences, right? Thinking about what we went through, good A and D, bad. It helps us hone that ethical compass, become better, more compassionate nurses.
Absolutely, and that's a great message for our listeners. As you start your nursing journey, remember, ethics, it's at the heart of it all. It's not always easy, but it's so worth it. It's about using your knowledge, your skills, and your heart to fight for your patients, keep the profession strong, and build a healthcare system that's more just, more ethical.
This has been fantastic. So much to think about, especially as I'm starting out. Thank you so much for sharing your expertise, your insights.
Happy to do it. Glad we could unpack all this together. And to all the nursing students out there, remember, you have the power to make things better. Never stop learning, never stop asking questions, and never be afraid to speak up for what you believe in. You'll make a difference for your patients, your colleagues, the whole system.
Couldn't have said it better myself. Thanks for being with us on The Deep Dive.